Hi, I'm Degé with the Patient Advocacy Network at CannabisSavesLives.org, and this is your next weekly edition of Compassion Flower Report, where I bring you news and information about medical cannabis around the world. We're going to be talking about headlines today from Canada, Texas, and Florida. It's been a relatively quiet news week, I would say. Um, Although, there is a little bit of a rumbling in Utah that there might be a lawsuit. I might cover that as I learn more in the next edition. It seems very fresh and new, and we'll see more about what's going on with that. But let's start with Canada. It says medical pot shortage to last 18 months, according to the Medicinal Cannabis Resource Center. This is out of Victoria, News 1130. It says if you use medicinal pot, it may be hard to get what you need for a while. At least one local organization is predicting a shortage in the country's supply could last up to a year and a half or even longer. There is no doubt that this supply shortage will not be quickly overcome, and part of the problem is simply down to the time it takes for producers to become licensed, said Terry Roycroft, head of Vancouver's based Medicinal Cannabis Resource Center, Inc., in a news release. Unfortunately, we were assured by our licensed producers there would be sufficient inventory on hand to handle the anticipated demand surge when cannabis became legal on October 17th. 132 licensed producers have been approved across Canada, but 65 of them are still going through the growing approval stage, according to Medicinal Cannabis Resource Center, Inc. The Cannabis Commerce Association of Canada agrees the shortage will likely be long-lasting, saying a switch by producers from medicinal to recreational is partly to blame. Right now, with the way that they've set up the recreational program, they've basically allowed the licensed producers that were forming the bulk of medical cannabis to transition their products directly to the recreational system without any kind of checks and balances, said Ian Dawkins, acting president of the association. It's not ethical to take the medical cannabis out of the medical system, out of the mouths of patients effectively, and expect that there's not going to be any consequences from that. Dawkins says the situation is quite dire for some people who rely on medicinal cannabis. We're talking about some people having none of what they need, none of the strains or the specific formulations that they need are available anywhere. They're left scrambling, and if you're dealing with a child who has, Dravet syndrome or some kind of seizure disease, that is not funny. That is not, oh, well, I'll just wait a couple weeks. There are life and death situations for some people. Dawkins wants to see the government to really push ahead with approving micro licenses, arguing it would increase supply in the recreational system, taking pressure off the medicinal one. So here's another situation. We're seeing it in different capacities in the states here in the United States. As each state begins to approve recreational marijuana, we're seeing how that affects patients. We're seeing how patients are finding it easier to be recreational and not renew their recommendation. They just would rather pay the taxes. We're seeing, like we are here in California, where the black market is thriving because the medical market has spiked so high, treating patients, basically a sin tax on being a patient instead of a sin tax on being a recreational user. And here in Canada, they're having just a shortage of supply. They've put the rules in place, and they've allowed for patients to have access, but now the product isn't there. If you've been following the Compassion Flower report at all, you'll know that one of the stories we did is that Canada is actually trying to contract with companies in Jamaica to bring cannabis up to Canada because, one, it appears that they can produce it more quickly, they can produce it more affordably. It sounds as though Jamaica is approving licenses more expeditiously and without as many loopholes. And, again, and this is something that I want to explore as this story continues, is based on the international law, the Single Narcotics Treaty. What laws are they skirting? What have they done? What loopholes have they created? Or they're just saying, black man, white man, rip the system, to transport cannabis from Jamaica to Canada. That's very interesting to me. But here we have a story where it is argued that the implementation of adult recreational has pulled the medical cannabis away from patients and has allowed these growers to make that cannabis available on the adult recreational market. I couldn't resist this one. I mean, one, I think it's interesting because one, I think doctors have to beware. It means patients have to beware where they get their medical cannabis examinations. Of course, I'm here in California where Prop 215 made that doctor-patient relationship very easy, but still, it had to be a legitimate exam. And here is a situation where you've got undercovers taking advantage. This comes out of none other than Broward County, Florida. Doctor busted after doing medical marijuana exams via closed circuit TV, cops say. So this is out of the Miami Herald, a story from Broward County. Two men went to Pembroke Pines High Life Medical Marijuana Center on 2 different days, each telling a doctor seen only on a computer monitor that he wanted a medical marijuana card so he'd have a legal excuse when workplace drug tests busted him. The doctor, Dr. Tommy Louisville, approved each in August. On Thursday this past week, he got busted. That's according to the arrest report filed after Louisville got cuffed on 2 counts of being a physician unlawfully issuing a medical marijuana certificate. The 66-year-old was in Broward County Jail Thursday afternoon on $100 bond. I don't think that's a typo. $100, that's all it says. Louisville knowingly added both undercover detectives to the medical marijuana use registry, knowing they did not meet the minimum qualifications, the arrest report said. Additionally, he ordered medical marijuana for an undercover detective, knowing there was no legal or medical need. The undercover detective, the report said, explained that he gets drug tested for work. He needs an excuse to test positive for cannabis. Louisville advised that he would add detective to the undercover to the medical marijuana registry. The time of that visit via closed circuit TV was 1 minute and 30 seconds. On August 9th, a different undercover detective repeated the ruse. He returned on September 25th, and the report said that when Louisville asked via closed circuit TV if there was a medical problem, the undercover answered, not really. So after 3 minutes of conversation, Louisville ordered 1,200 milligram of cannabis, medical cannabis inhalation. And the story ends there. We still have these stings going on. We still have in states where cops are testing doctors. We see in other places where Law enforcement is going after rogue retail operations, where in other communities they're going after rogue cultivating activities. So there's definitely, with the tax money and so forth, and people having a permit and a license, there's definitely incentive to get the bad players out of the way. And it's good. We can't have bad players in medical. We already have too many bad players in medical, and unfortunately, most of those bad players happen to be the politicians. Um, but speaking of politicians and medical marijuana, here we've got San Antonio State Senator files medical marijuana bill for Texas. This comes from KIII-TV 3 out of South Texas. It says a Texas state senator filed another bill this week to allow medical marijuana in Texas. Um, so if this rings true, we just had an election where Missouri and Utah have been added to the medical marijuana list. If things continue to go forward, we could see Texas and Tennessee be two of the states that could be next for medical here in the United States. Senator Jose Menendez's office announced Monday afternoon that he filed a bill to allow medical marijuana in Texas. Senate Bill 90 is a comprehensive, compassionate medical cannabis bill, his office said in a news release. The proposed legislation would increase the number of debilitating conditions that qualify for the Texas Compassionate Use Program. Texas would become the 33rd state to allow medical marijuana for patients that qualify. Menendez's office said that Senate Bill 90 would allow doctors to treat medical cannabis like other medicines. Doctors, not politicians, should determine what is best for Texas patients, said Senator Menendez in a statement. Studies have proven that cannabis is a legitimate medicine that can help a variety of Texans, including individuals suffering from opioid addiction, veterans coping with PTSD, cancer patients, and people on the autism spectrum. Texas should provide real relief for our suffering patients. Patients should not be arrested for using a medicine that is legal in every other state that borders Texas, including conservative states like Oklahoma and Arkansas. The legislature must act and provide medical freedom to those who need it the most. Menendez filed medical cannabis legislation twice before: Senate Bill 1839 in 2015 and Senate Bill 269 in 2017. He also co-authored Senate Bill 339, allowing for limited cannabis use for people with intractable epilepsy, meaning traditional medicines did not work to control the seizures. So again, we've got a compassionate person in Texas who sees that there's a need. Texas has been going through this for a while, and they seem to get really, really close, and then and then something goes down. So let's hope that we will see movement in Texas. I love hearing this language that doctors, not politicians, should determine what is best for Texas patients. We don't see that kind of language, especially in California, where we have politicians who want to regulate every single aspect of everybody's life, from what kind of straw you use to how you bag your groceries, to everything. So hearing that politicians want to create laws where they step aside and let there be a citizen relationship, in this case a doctor to patient relationship, and the politicians get out of the way, that's the way it should be. Because right now in California, because of the hyper involvement of our government, we have hyper regulation. I do consulting with people who are either wanting to get into the industry or learn how it is they can legally do so and comply with rules. And I think about 3 or 4 times today I heard people say, but it's legal. What do you mean I can't do it like this? What do you mean I have to have a license to get it from point A to point? What do you mean I can't buy it over here and sell it over here, that I need some permit to do that? People are having to get used to the fact that California has one of the most restrictive regulatory schemes in the country, from going from one of the more lax to one of the most strict now that we have recreational. I'm sure that other states can say the same thing. I think our biggest setback, and again, I've left this link below before, which is our position paper, which explains why you have to remove cannabis from the Controlled Substances Act. But as long as we're dealing with cannabis in the Controlled Substances Act, the federal government is going to continue to put pressure on state governments to have these extremely restrictive seed to sale trace and track programs. And my hope is that when we change the laws and we get cannabis out of the Controlled Substances Act and we quit treating it like it's some boogeyman, like it's going to jump out of the bushes and kill somebody, and we can treat it like the plant, the wonderful plant that she is, and not have this track and trace system, then yeah, that we can see these rules relax. We can see the expense of regulation relax, and hopefully we can see some sensible, reasonable policies. But like I said, I'm working with people who are trying to comply, and there is a tax and a fee from the time you put the seed in the ground to the time you let that plant grow, to the time you take a cutting, to the time you harvest it and you cure it and you weigh it, and then you get part of it over here to be packaged up for jars of flowers, and some of it goes over here to become hash, and some of it goes over here to become butter for cookies, and every single one of those steps has a fee and a tax, and it is making cannabis so expensive in California that unfortunately the black market is still king. There are still temporary Instagram pages and temporary Twitters that go up and be like, hey, harvest is ready, give me a call, boom, boom, boom. They know somebody, they get their harvest out. And meanwhile, unfortunately, the mom and pops who are trying so hard to do it right and stay alive are having the most difficult time. So you've got the black market thriving, and you've got the mega corporate cannabis in California that's thriving. These are the people with tens or hundreds of millions of dollars of investment behind them that can kind of wait out the storm. They're doing okay. It's those mom and pops in the middle. And the real frustrating thing about the mom and pops in the middle is they're the ones that have weathered the storm of being the pioneers, going down to the city council meetings and going on public record and trying to get regulations, trying to overturn bans, dealing with the DEA smashing in their door with a battering ram, getting hogtied, and having all their inventory taken, having their cash registers smashed open, having their safes robbed, and being told, oh, once we leave, you can reopen. It's the people who really, really, really weathered the storm and haven't sold out to these mega corporate cannabis companies are the ones that are really, really feeling the pinch. So, Patient Advocacy Network, we're here to work with everybody. We want to see cannabis on every spectrum. We don't care how wealthy the company is or how small the company is. We want to see every viable business option for cannabis survive in this country, that it doesn't just have to be up here or in the middle or down here, that it can be everything in between. And hopefully the rules will be such that there won't be a need for a black market. If legalization was actually working, there wouldn't be need for a black market. All these stories and more are available at our Twitter at Pan4Compassion. I always leave that link for you below. You can sign up for our email updates where we send news, action alerts, and more. I want to thank you for watching, and please donate. Patient Advocacy Network is a charitable 501c3. Your support is always tax deductible. We can't do this work out in the field and change these laws on behalf of patients without your support. So please visit our website at cannabissaveslives.org. Click the donate button, become a monthly sponsor in any amount that is right for you. Please like, subscribe, and share this video. And until next week, I'm Degé Coutee, and this has been the Compassion Flower Report.